What's up, guys? Quick training video here with Travis, and today we're going to go over blood works. All right. Now, primarily, of course, the directors, Tyler, Jordan, Dave, you guys are handling these blood works, but sometimes you get on the phone and get asked a question or get wrapped into it. So some of these points are going to help you out universally on phone calls. So number one, greeting. Any phone call, when you call one of our patients, we're very clear with Buckeye that when you join one of our programs, your family. A lot of these people's family aren't going to be working as close with them as we are on some personal issues, so we do treat them as such. So when you call, don't say, hey, hi, is this John? No, if you looked up his number, just call and say, hey, John, how you doing? Or say, hey, Amber, how you doing? Not, hey, is this Amber? They're going to associate you with, anything businessy, and they're not going to have that warm affinity like we want them to. So a good conversation always starts out with a great greeting. Number two, be clear. Be clear with your voice. Speak clearly. Articulate your words correctly. Your voice inflection. Make sure it's a tone that they can hear, but also make sure you meet with the medical provider. If there's something you see on the message you have to relay to the patient that you're a little bit unclear about, make sure you get clear before you take the phone call or before you answer the question. Okay. Number three, be thorough. So though we want to speak clearly, we want to be thorough with that information we relay. So make sure you're going through everything and they have an understanding for it. I know sometimes blood work calls can be a little bit annoying, when you have a lot going on, but that extra second you take is a stitch in time that saves 9. Go through the information thoroughly so that way they don't call back confused, especially if you're leaving a voicemail. If you're leaving a voicemail, go through all that information twice, very clearly. I know I'm Mr. Reiterator, but that's because nobody ever hears anything the first time around, right? And not being clear on a voicemail can cause you to have, 6 or 7 phone calls back and forth while you're handling other things throughout the day when it could be just handled with a thorough voicemail. Number 4, any patient that's disqualified because of an ailment or a high PSA, right? So not somebody that comes in and has adequate levels and doesn't need any type of therapy or treatment, but somebody that's on the program or comes in and has an elevated PSA or is disqualified. We want this to come from the medical providers, all right? Information can get twisted, so we want to make sure the medical professionals are handling this. Now, it's easy to get a phone call, hey, I got a high PSA, I really want to have some clarity on this, and maybe Melissa or your nurse practitioner is with somebody, and you need to get them an answer or you get stuck. One thing you can let them know is prostate inflammation or your high PSA level through a blood work is a very inaccurate test. You can have a slightly inflamed prostate over several different things, and it could show that on a blood test, all right? So all they would put them at ease initially, say, yeah, okay, that's not the most accurate test, and several things can give you some slight inflammation. And if anything, testosterone in both men and women is one of your body's most elite anti-inflammatory, so it's going to aid in that process. Just let them know to take 3 days off, no sex, no riding a bike, and we will retest. All right? If they have any more questions, make sure you get them with the medical professional or let the medical professional handle that right off the bat. And 5, lastly, promote and help. So number 1, promote. If somebody's saying, hey, how you been feeling, John? How you been feeling, Amber? I feel great. I've lost the weight I wanted to, or I feel great. My libido is where it needs to be, and I'm getting great sleep. I have noticed times going on, it's the holidays, I am starting to put on some weight, and it's been coming on faster than usual. You can talk to them, well, I see in your blood work, your growth hormone was below 200, and that can cause a slower metabolism. And we do have Sermorelin that can increase your growth hormone along with your basal metabolic rate. So come in and we'll talk about it. Or just at least plant that seed. Or melanotan, if it's winter time's coming up. Say, hey, by the way, do you tan? A lot of ladies do. A lot of guys do as well. Let them know, hey, you don't have to go to the tanning bed. You don't have to worry about wrinkly skin. We have melanotan. It's a peptide, which is a series of amino acids that carries the function in your body, and it's much more safe in the long term. Any libido, erectile dysfunction, or sexual dysfunction, P-shot, O-shot. You can also let them, hey, by the way, the treatment of the month is our PRP hair treatment. This is for our regenerative medicine. It actually helps stimulate and grow, new hair follicles, yada, yada, yada. So again, the 5 steps. Number 1, greeting. Talk to them like their friend. Because if you talk to them like their friend, they're going to be your friend. 2, be clear with the information you're getting. Ask the nurse practitioner if you have any type of questions. Make sure you go end that conversation confidently and with certainty. That way the patient receives it with confidence and with certainty. 3, be thorough. Take some time. Again, Stitching Time Saves 9 on this. Disqualification, get with a medical provider, and you have a handle on those PSA issues. Just run that back and promote. And lastly, I didn't say help. Let them know, hey, just so you know, anybody that, is there anybody that you know that's been struggling with some of the same symptoms you were? Because anytime you refer somebody that starts up, that is a month at no cost for you. Don't want to push, but if there's anybody we can help and help you out as well, just let us know. Other than that, send in a response with 4 sentences, and that's it. Rock on, guys.